indeed great pleasure to see so many of our professionals from the different parts of UAE assembling here to participate in the 9th annual conference on physical therapy being hosted by the College of Applied Sciences, Accredited University. The theme being a national conference on multi-disciplinary approach to management of low back pain. On behalf of the founder president of the university, Mr. Ajman, the academic leadership headed by our provost, Dr. Shokraj, and the associate dean, College of Applied Sciences, Mr. Praveen Kumar, it's my pleasure for taking the opportunity to welcome you all to the university, and a very special mention to the presence of a great friend, a guide, and an inspiration, Dr. Ajman. Welcome to the university, and we are equally privileged by the presence of Dr. Margaret and our classmate masters. Thank you so much for being with us this morning, and we are really so joy. Once again, welcome all. Kindly introduce the first speaker, Dr. Ajman, and wish all the very best to each one of you. And I hope that you will just enjoy the hospitality and the scientific feast that will be on offer for the
بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا.
Thank you, ma'am, and welcome to this program.
Respected Madam Provost, I would like to take the liberty of introducing our Madam, who is the backbone, support and the encouraging spirit for all of us. Thank you very much for coming in today. We are honored and privileged by your presence. Following on, respected speakers, invited speakers, on a moment of limitation, all of you have taken the initiation and allotted time. On a personal note, I would like to thank you all for making it today. And the dignitaries who have come, the guests who have come here today, members of my alumni society, my present society, students, faculty members and staff of College of Allied Sciences, I would like to extend a hearty welcome on behalf of the management and College of Allied Sciences for coming in and gracing this occasion. Thank you very much.
Good morning, ladies and gentlemen. I'm always happy to be part of these scholarly events that we hold from time to time. In fact, every college in the university is encouraged to organize such events and build up their professions and contribute to the professional practice. Today, I can see that the scientific program, as the title says, is multidisciplinary approach, and I can see from the talks and the speakers who are speaking that they have organized the input of multiple disciplines into the management of a low back pain. This is the trend and this is how it should be. Knowledge and experience which is present in the various disciplines comes together with the sole purpose of helping and treating and managing a disorder in a patient and ultimately give relief to the patient. In fact, in this university, as you can see from the colleges, we have colleges of medicine, pharmacy, dentistry, allied health sciences, and the graduate studies, which means we are a community of different professions. When we talk, when we organize, when we do events, we always form a team. It is not just multidisciplinary but multi-professional too. So it's always a pleasure to be present in any of the events that are organized by the individual colleges and see everyone together playing a role in medical and health practices. I take special pleasure in coming for especially events which are related to orthopedics and physical therapy in special. I'm a pathologist by training and my training is mostly in orthopedic pathology. So I spend a lot of years with my colleagues who happen to be either orthopedic surgeons or physical therapists. So I once again welcome you all to this university. All of you who have come in today, taken up your time to not only attend these sessions which have been organized, but this will certainly go a long way to your own personal and professional development. Thank you.
silent but very enthusiastic senior most faculty members from the College of Allied Health Sciences. Please come on stage and take this appreciation. I request all the speakers to please.
Understand the importance of the skin when you apply tape on structures underneath, but it's more than that. We call it conclusions, and these conclusions creating what we call it space. A space where the tissues can start breathing. And KTT techniques, you don't have to compress anything. You need to decompress. It's the same idea. These little points to move by itself and heal naturally. Well, if we ask ourselves what things we can technique and treat, basically can treat. Eventually. And for the non-athletes, but as we think, just for athletes. And I'm coming out to the point where you actually have would you? Okay. When you have a training started 6 months ago, right? I can see that you're bodybuilder, strength and condition coach, right? So when you start your training in the morning, what time? Right? And like we said, right now. So right now. Well, I'm going to share with all of us techniques doing a different running your experience. Okay? I'll just open it first. See how much tension you have in this. So what we're going to do here, decompression effect, can relieving the pain in the fascia in this area. Right? So we're taking the tape that way, we cut it off. The technique which I'm going to do right now is a space correction technique and decompression technique to relieving the compression of that particular area over there, right? So this is the first part. Okay. So what we're gonna do here, we're gonna decompress and we're gonna allow also the vascularity of this area to be more by asking the patient to lean forward, please. Can you lean forward? Take a deep breath, please. Hold it in, leave it there. But you can see this, there's no tension, it's almost zero. Come back over there. Asking the patient to relax. Relax, please. Thank you. And then the second part where we are actually supporting the cervical muscles. Creating a space also over there. And this is what we call the space correction technique. Okay. Can you breathe, please? Hold it. So this is what we call it the conclusions, and you can see it here. Everybody can see this. You see? This is what we call it the decompression. We're trying to decompress the structures, all skin fascia, everything, just away from the muscles and neurostructures. We're gonna give the patient the opportunity to move again forward and tell us, out of 10, how much your pain matters. Very serious. What do you feel? Can you share with us what you feel? Okay. So you feel like you've been corrected. Thank you very much. That pregnancy. For their physiotherapy session, I want also to highlight that kinesiotaping technique cannot be treat everything. Well, the program was for 21 days. Take it. It's 100%. And back again to the question here about 25, 15, 35, anything. I mean, if you guys allow me to talk about this one, so
We have been exposed to another type of tape which most of you are aware of, mechanical tape. Right. Kinesiotaping, mechanical taping goes parallel. It's a new concept. I agree with Sir that as physiotherapists, we need to identify all the possible causes, rule out everything else. I do agree with Sir that he is a KTG, so he wants it for the patient. If he is some other neuromuscular technique person, he will go to it. So the basic concept of trying to put in everything was that the profession of physical therapy is evolving. There are a lot of things which are coming in. We need to keep abreast as to what is happening around the world, so that we don't try to limit ourselves that what we have learned in the schooling ages is what is happening. That was not the reason. He is standing here as a KBT, I 100% accept, but as a clinician, I would stand with Dr. Zara that we have to identify all the problems, try to go, confirm it that it's only fascia, only then KTT can do wonders. KTT does wonders for our diagnosis, which tries to give you a thing telling that physical therapists have to involve in diagnosis. We will have to diagnose the problem and then try to identify where the problem is coming from and attack that problem in that way. Because we are in the academics, we try to think of it in this way, that try to concentrate, all of us should think that how much we can think in terms of identifying the cause of the problem, then things are better. I hope I've clear. Thank you.
I'm very, very much from the side, but we are presenting today on the side. That's it. Anyway, it was my great honor.
Lively action-filled presentation what we had here. Now we are moving to the next topic. This is on physiotherapy and evidence-based practice, which is presented by Mr. Praveen Kumar, the Associate Dean of
As usual, we invite the hands-on interest to support me. After trying to finalize the program which we thought most of the people are going to come with the physiotherapy practitioners. Another trying to think about just how we can try and enhance the knowledge of this. Most of the time, what has been specifically done. So this lecture which I am trying to talk to you, or the discussion which I am having in front of you, is a different type of physical therapy approaches which we are trying to all things still standing out. How much of it is good for us? What can we do justification? That's why we try to in terms of, let us try and talk in terms of the evidence base. Throughout the literature, throughout the level 5, the first one which is standardized is the systemic review of this, that is RCTs, therapy, lumbar actions, lumbar supports, thermography, TANs, ultrasound.
Till completion beyond your comfort zone. Finally, I thank you all for coming here and making this seminar, a conference, a grand success. And we anticipate a similar cooperation in future also.